Well, basically, this is a dispute about pay and also the state of the health service. Our members who work in a health service have seen real terms pay cuts after the last decade. We calculate their earnings have basically gone down 20%. The government have imposed a 4% pay offer. It's about a third of where inflation is at the moment, and our members are just saying enough is enough. Well, basically, there really haven't been any negotiations. The government have a pay review body that's come out with a figure of 4%. That's been imposed. We've made it clear to the government for the last 6 months we want to talk about this. We want to get round the table. We heard Zahawi on Sunday, talk about how negotiations should carry on. Well, we wish they'd started. We need the government to come to the table to realise how strong the strength of feeling is amongst our members, and actually to put forward a decent pay offer. Well, at the moment, the NHS is in crisis, and the reality is that people aren't seeing the medical care they need at the moment. We've got people waiting 26 hours to get an ambulance to come to them. We've got 1/3 of our members are talking about having had an avoidable death caused by delays. The real concern for us is when we're going out on strike, if it wasn't for the picket lines, I think the service is so bad, people might not notice. This is a cry for help, and the government need to listen. We are going to be meeting trusts on an individual basis. We are going to be agreeing emergency cover, but the reality is an ambulance dispute like this is going to have an impact. We will do what we can to make sure the most needful cases are covered, but it will have an impact on the public. Well, we want to see the real engagement from the government. We need them to understand that after 10 years of austerity, a below inflation pay rise is not going to fly. We need for them to come to the table and do exactly what Zahawi said, which is to negotiate. And negotiate means they need to come forward with a meaningful offer. They need to address the problem of pay, which has led to 135,000 vacancies in the NHS. And unless pay is addressed, this is going to get worse. We rely on the NHS and we need it to function. It's what we pay our taxes for. Well, we think it's very significant. The last big ambulance strike was in the 1980s. I think the fact that our members haven't really gone out on strike for that period of time just shows how fed up they are. Our members do their job to save lives. They don't want to be in a position where they're manning picket lines, but they think they have no choice. Oh, every strike is an attack to say something needs to be done. There's never a right day to take off on industrial action. The reality is the rules on industrial action kind of force us in when we can take action. We would be very happy to go back to our members before that date, say the government have come back with a better offer in pay, and if that happens, we will talk to our members and ballot them on what that is. Until that happens, then frankly, we have no choice but to take this action forward.